Coming up on Medically Speaking, we learn how we can prevent heart disease and keep our hearts healthy and fit, see a better way to prevent skin issues, and the latest in advanced skincare technology. We learn about wellness insurance initiatives for adopting a healthier lifestyle, how technology and screen time are affecting children and teens. We visit a men's health clinic focused on testosterone optimization and overall wellness, and a long-term residential recovery center offering hope and healing to adults living with substance abuse disorders.
According to the CDC, in the United States, someone has a heart attack every 40 seconds, and the leading cause of death in North Carolina is heart disease. So having access to high-quality cardiovascular care in our community is invaluable. I'm here in Scotts Hill with Dr. Christopher Ellis. He's a cardiologist with Novant Health Heart and Vascular Institute. Dr. Ellis, what is a heart attack and why are they so prevalent?
Well, a heart attack is a condition where one or more coronaries become severely or completely blocked, and that leads to a part of the heart muscle that doesn't get blood flow like it needs. If that goes on long enough, that causes injury. Heart attack typically is caused by a disease process called coronary disease. People also refer to this process as hardening of the arteries or coronary atherosclerosis. And in that condition, plaques build up in the artery walls, and if bulky enough, can lead to significant obstruction of flow to a heart muscle. Sometimes these plaques can rupture or fissure, leading to sudden blood clot formulation in the artery, which will ultimately lead to restriction in blood flow and heart attack. That's typically what most heart attacks are caused by.
And why are they so prevalent?
So it's due to the prevalence of risk factors in our population. Things like lifestyle choices, other health conditions, age, family history all feed into that. Now, lifestyle choices could include smoking, poor diet, sugar, salt, fat, heavy diets, processed foods. Also, heavy alcohol use, stress, lack of exercise. And you look at the other health conditions that people have too, diabetes, high blood pressure, cholesterol issues. Even things like obesity and chronic kidney disease can feed into heart disease. Obviously, also, the older you are, the more likely you are to have coronary disease. And finally, family history. You can't do much about that, but it's important to know that ahead of time.
So how would someone know if they're at an increased risk for developing cardiovascular disease or a heart attack?
Generally, the same risk factors that we talked about just a second ago are how we figure out what somebody's risk is. There is a nice 10-year risk calculator that's published by the American College of Cardiology that's available on any phone, tablet, online, and can be done to help further tailor management plans.
And what should I do if I think someone may be having a heart attack?
If you or yourself or around somebody who's having symptoms that could be a heart attack, it's important to first call 911, get medical professionals on the scene. If you know CPR, then you can start CPR as well.
All right, well, let's go check in with Lizzie. She's in cardiac rehab. It's one of the critical components to post-heart attack care. After having a heart attack, many patients will need rehabilitation to fully recover. Novant Health recently expanded their cardiac services to Scotts Hill to make access even easier. I'm here with Lizzie Capps. She's the coordinator for cardiac services. Lizzie, why is cardiac rehab so important for your patient?
Well, a patient that completes a cardiac rehab program lessens their chance of having a future heart attack or being readmitted to the hospital. Cardiac rehab is a lifestyle modification program. Patients come in a class type setting, they exercise, they go to education classes where they learn about cardiac risk factors and how to make healthy changes. We do stress management, nutrition counseling, tobacco cessation, and there's a really strong camaraderie in the classes because patients are with others who've been through similar situations. Patients leave with an improved sense of stamina and confidence, getting them back to the activities they enjoy doing.
Thank you, and thank you as well. For more information, you can visit novanthealth.org/heart. That's novanthealth.org/heart for more information or consultation. We'll see you next time. In the heart of Midtown Wilmington, near the Point at Barclay, is a new state-of-the-art medical facility, Waccamaw Dermatology. Waccamaw Dermatology has been serving patients since 1984, and they're recognized as a leader in skincare and technology, and now they're in Wilmington. Let's go check them out. Welcome to Waccamaw Dermatology. This is Ashley Crockett. She's the practice manager. Ashley, would you mind giving us a tour?
Absolutely, I would love to. So when patients come in, they are going to be immediately greeted by our wonderful front desk team, and they are going to have access to a comprehensive range of skincare services, including general dermatology, Mohs surgery, superficial radiation therapy, cosmetics, and a comprehensive line of skincare products. So we're very excited to be here. We have over 10,000 square feet of space with 19 exam rooms and surgical suites, and we will be able to at times offer next day appointments as well. So we're very excited to be able to provide that to patients.
Well, we're going to meet the CEO, Erica Rosenthal, and see what she has to say. Let's go check in with her. Joining me is Waccamaw Dermatology CEO, Erica Rosenthal. Erica, we are thrilled to have Waccamaw Dermatology here in Wilmington. What went behind the decision to expand to Wilmington?
At Waccamaw Dermatology, we are really committed to having access to quality care in dermatology. Every year in North Carolina, there are over 4,200 new diagnoses of skin cancer. And it is so vitally important that people get early detection. Coming from a coastal town, we know that coastal cities are underserved, and we're committed to getting the care where it needs to be.
With Waccamaw Dermatology being in practice for 41 years, what's the difference with Waccamaw Dermatology?
Although we're probably most known for skin cancer, we've seen generations of family, and that's everything from acne, rashes, eczema, psoriasis, any skin condition. And so we're committed to being here and being able to get people in. And Waccamaw Dermatology has everything you can find at a major academic institution, but with the family feel of a physician-owned practice.
Tell us about this beautiful new office space and this great location.
It is a modern, state-of-the-art facility. It is in a great location off Independence Boulevard in Midtown in Wilmington. And we've got a Mohs laboratory. We've got a number of treatment rooms for providers to see patients, number of services that are here. So right now we have next day appointments, and get them while you can.
All right, we're going to meet one of your providers, Jill Maddox, and learn more about the services. Let's check in with her. This is Jill Maddox, nurse practitioner. Jill, let's talk about skin cancer. What do you tell your patients, and what treatment options are available?
I tell my patients they need at least a full body skin exam baseline, and your provider can tell you going forward whether you need to return for anything. You know, enjoy life, go out in the sun, but be careful. Seek the shade more often, wear a hat with a brim, sunscreen, SPF of 30 or better, reapply it every 2 hours, and don't forget your sunglasses. We offer comprehensive care here, from skin checks for rashes, lesions, acne, whatever you need. We see patients from birth to geriatric, and we offer Mohs procedures, excisions, and image-guided radiation therapy.
And tell us about the physicians and staff here at Waccamaw Dermatology.
Dr. Coakley is our Mohs surgeon, and myself, and we'll be adding 2 more NPs. I currently have 3 MAs and 2 front desk, and they're a great staff. We're ready to go.
Great, well, thank you so much.
Thank you.
Now accepting new patients. To make an appointment, visit waccamawdermatology.com. That's waccamawdermatology.com. Health insurance can feel overwhelming, but it doesn't have to. Today I'm joined by Conette Bradley, the owner of NC Insurance Advisors, and she's here to help you find the right coverage for your needs. I'm here with Conette Bradley. She's the owner of NC Insurance Advisors. Conette, when someone's trying to figure out which health insurance plan is right for them, it can get real confusing really fast. So what are some reasons that people come to you for help?
Because it is confusing. Whether you're under 65 or on Medicare, it is very confusing. And government websites are not as easy to use as you would think. But they come to us because we know what we're doing, they get the information, we help them with their choices, we simplify it and follow up. We're here all year, so they can come back and ask questions or come in if they have claims issues. So we're here for our customers.
When someone's shopping for a health plan, what are some questions that they should be asking?
Actually, we have to ask the questions mostly because we have to know what your projected income is for the year that you want coverage, how many people are on your tax return, and all of those things determine what plans are offered to you and whether or not you qualify for subsidy from the government, also known as an advanced premium tax credit. Now, those have been very beneficial for many people who now have zero premiums and extremely low copays and out-of-pocket maxes. However, people who don't qualify for the subsidy because of what they earn, the benefits are not good. Maximum out-of-pocket over $19,000 for a family. It's unaffordable, and we have a different demographic now going without coverage. And since North Carolina expanded adult Medicaid, which is ages 18 to 64, December 1st of 2023, now we have lots of people who are getting subsidies being sent to Medicaid. And if you think about it, Christina, it's economics. And if Medicaid reimburses this much, and Medicare reimburses this much, and commercial insurance reimburses this much, who are you going to see? You have to pay your staff at the medical office. So there are a lot of things that are not right. People don't have the choices they used to have. And oftentimes people end up earning more than they thought they would, or they have to take money out of their 401k because they need a new roof, or they have other medical expenses. And then they have to pay all the subsidy back. And they find out the next year when they file that tax return. And it has been devastating to many. And I do have clients who can afford to pay $2,000 a month or $2,500 a month for a couple, but they refuse to do it for the benefits that come with that price. Also, health savings accounts. They're great because you have skin in the game to pay for your little things and tax advantages. Some counties you can't buy an HSA because they're not sold on the exchange or where you are dealing with the government in the middle of your health care. Therefore, you have to pay full price if you want an HSA. So choices are very limited. Benefits are all over the place, and so are the premiums, from $0 to $3,000 a month, a mortgage, and people are just upset with losing choices. Now, they do have to ask us about, is there a doctor in the network? They have to ask that question. But oftentimes, there's only one network in their county. And, so people are having to take different doctors that they aren't used to. And with the Medicaid expansion, so many people lost their subsidies and got put on Medicaid. And they can't find a physician. They can't get an appointment for 8 months. I think there's one eye doctor for Medicaid in Wilmington. Another friend of mine on Medicaid was given a dermatologist in Clinton, and the appointment was like 8 months out. So things are not as smooth as some would like to think.
Do you also help people on Medicare and those just turning 65?
Absolutely. We have a lot of people who move here because of their grandchildren, and we help them change their Medicare plan. And of course, during the annual enrollment, when they can sign up or make changes on their plans, that's October 15th through December the 7th. We do a lot of assistance during that time because so many plans change for the new year. But yes, we help a lot of people turning 65 and those already on Medicare.
Conette, thank you for sharing your expertise with us today. Thank you for joining us as well. If you're looking for help in navigating your health insurance options, NC Insurance Advisors is here to help you. Thanks for joining us. We'll see you next time. Welcome to Medically Speaking, where we bring you expert insights to help you and your family make confident and informed decisions about health and wellness. Today we're joined by Dr. Erin Adanino. She's a board-certified pediatrician at Wilmington Health. She's best known for her award-winning work in medical education and collaborative patient care. And today she's going to help us tackle a timely and often tricky topic, which is kids and technology. So without further ado, let's jump right in and meet Dr. Erin Adanino. Dr. Adanino, in today's technology world, what is the right age to introduce a smartphone device or tablet to a child?
That's a really great question. So there's not an exact age. Many children actually end up getting a cell phone in middle school, but what matters most is their maturity. Can they follow rules, handle screen time, and understand internet safety? I typically recommend starting with a basic phone first and then moving on to a smartphone. There's a helpful phone ready questionnaire by AT&T that can be found on the American Academy of Pediatrics website, and that can help guide parents. And some families are also following the wait until 8th movement, which encourages waiting until the end of 8th grade for a smartphone. All of that's to say, both the child and the family should be ready for phone use.
What are some of the long-term effects that you're seeing with kids and technology?
Yes, and so social media is a big one. That can affect sleep times, attention, and can even be addictive. It's designed to trigger dopamine hits to keep kids scrolling. And in teens especially, it can be almost like a constant popularity contest, which can take a toll on self-esteem.
So how can parents set healthy boundaries when it comes to things like screen time, apps, and devices?
Setting clear and consistent rules is key. So I often recommend that families have a tech plan with things such as no phones at the dinner table, setting time limits on using screens, and also not allowing phones or tablets in the bedroom at nighttime.
Ooh, I like that one. We always have a time before bed, so it's no phones after 8 p.m. So that way it gives them some downtime before bed.
Yes, I think that's perfect.
Are there any applications or parental controls that parents can implement to help manage these boundaries?
Yes, and so a lot of new phones or tablets do have parental controls. And while those are helpful to use, what's really most important is actually having open conversations. So kids should feel comfortable coming to you if they see or experience anything concerning online.
Technology moves so fast, it can be tough for parents to keep up. What advice do you have for families to help keep kids safe online?
Starting with an open conversation is key. So asking your kids what apps they're using, who they're talking to, making sure that privacy settings are turned on, and encouraging them not to share any personal information like their full name, their school, their location, and remind them as well that if they ever have something that's uncomfortable online, to feel free to come and talk to a trusted adult.
I imagine these conversations are a lot easier when they're younger. Do you have any last-minute advice for teenagers who may be more unwilling to share their device with their parents?
Yes, so teenagers can often be tricky because at their part of development, they are allowed some privacy as they're becoming adults. But what I really like to emphasize is that if they start making poor decisions or uninformed decisions while they're growing, that's when parents really need to step in and start helping to guide them.
What about setting screen time limits daily? Is that a good idea?
Yes, I think that's a great idea. Ideally, we should limit kids and teens to less than 2 hours a day of screen time. And there's wonderful apps that now exist that can give timers on how much time your child still has left and can automatically shut off at a certain time.
Well, thank you so much. I know this topic is tricky, but it is on the minds of a lot of parents. So I hope that you found this information insightful as well. Thank you for joining us on Medically Speaking, and we'll see you next time. Whether you're a working professional or an active dad, Game Day Men's Health offers convenient, expert-backed care for men of all ages. I'm here with the franchise administrator, Russell Eberher. Russell, how did this concept get started?
My business partner, Will Connect, and I started looking for non-food franchises a handful of years ago. When we saw Game Day Men's Health, we knew we had hit a home run with it. It was game time for us. Game Day Men's Health is a national franchise with over 1,000 locations and territories sold. We decided to go all in and bought 11 territories in North Carolina, South Carolina, and Georgia. The fact that men get to go to a place that's a man cave environment, put on sports shows, ESPN, whatever they may do, and feel very comfortable. It's in and out kind of type of service. We have free consultations from a board certified clinician, and we also have complimentary blood testing. So you can get your blood levels checked. Within 15 minutes you get the results. We don't have to send you anywhere else. And it's just a great way for guys to come in and take care of their hormonal health.
Yeah, well, women have women's doctors and now men have men's doctors. Let's hear more about your services from your general manager.
Yeah, absolutely.
I'm here with the General Manager of Game Day Men's Health, Brad Godbold. Brad, tell us about the services that you offer.
Yeah, absolutely. So testosterone replacement therapy is the primary thing that we offer in clinic. A lot of people don't know we also offer peptide therapy, weight loss therapy, sexual performance enhancement, vitamins, and Botox in clinic as well.
Well, when people hear testosterone, they think, big buff guys at the gym, but that's not the case.
That's really not. There's still a lot of stigma around the word testosterone and thinking gym muscle heads. What we're really trying to create here is better optimized dads, husbands, fathers, to be able to be active in their lifestyle at home.
And you were telling me that 25% of men over the age of 30 suffer from low testosterone. Is that true?
So statistically speaking, 25% of men over the age of 30 have one or more of the symptoms of low testosterone. But what we're seeing as men come into our clinic is that it's a higher percentage of that. So the 25% is just based off of men who have actually been tested. If they haven't been tested, then we don't know. Men coming into our clinic, we're seeing a lot higher number than that.
And what are some symptoms or some signs that these men are telling you that they feel?
So the main symptoms that we deal with aren't associated with the body. We're actually looking at symptoms of depression, fatigue, brain fog, sexual performance, and then the inability to lose weight or put on muscle.
And so you offered free screenings because it's really important, along with the cancer screening. What is that process like?
So that process looks like, if you want to come in, there's multiple ways to you can make an appointment via the phone or use our web form. You fill it out, we're going to reach out to you to schedule that appointment. If you fill out your paperwork ahead of time, when you walk through our doors, you're going back to get a blood draw. Part of that blood draw is going to be your total testosterone, your PSA level, which is our prostate specific antigen. That's that cancer screen that we're looking at for free, as well as your hemoglobin levels, which is how thick your blood is. You're going to get the results of that test in that appointment, about 25 minutes to get the results, and then you're talking with the physician, going over the results, and then coming up with a game plan.
Well, we all know health is wealth. What would you say to any man or person watching this right now about their health?
I would say get tested. It's a free service. It doesn't cost anything. We're not going to hog tie you and take your credit card. So come in, get tested, see where you are. You may be perfectly fine, but it'll give you a baseline to see where you are, and then how you can optimize your health to be a better dad, better husband, better son, whatever the case is, and then that's going to carry on into your workload as well.
Yeah, and people listening, they might be a little apprehensive about the supplements that they have to take. Talk to us a little bit about what that's like.
So we do have our own line of supplementation that we will offer if it's something based on the blood work that we see that you need. Primarily what we're going to do is going to get you on your TRT or your peptide therapy, which is going to be 1 to maybe 2 injections at max. So it's not a lot. You can come in clinic and get those injections. You don't have to do it at home. And then if you need further supplements, we have the ability to put those on your program as well. It's just a really easy daily tablet, just like your supplements from any other store.
Brad, thank you so much. To schedule your free consultation, you can visit their website. They also have 2 locations in Wilmington, Game Day Men's Health. We'll see you next time. Today on Medically Speaking, we're highlighting a place where recovery begins with connection, the Healing Place of New Hanover County. Since opening its doors in 2023, they've served over 2,000 individuals, providing no-cost, long-term support for those struggling with addiction. We're joined by Brian Minga, he's the executive director, and Annette, she is one of the proud alumni of the program. Brian, what was the inspiration behind creating the Healing Place of New Hanover County, and how are your peer-led programs different from the other recovery programs?
Yeah, so ultimately the need within this community and the broader Eastern North Carolina for folks struggling with substance use and really having an alternative to the medical model of treatment that has been more prevalent over the past 20, 30 years. So the peer-based services, you immediately get credibility with folks, and they know exactly what people are going through because they've walked a mile in their shoes. And the ability for them to give somebody a sense of hope, you can't replace it with a clinical perspective. So we will also never have really a client-clinician relationship. It's always going to be peer-to-peer, and who better to say what will work is somebody that has gone through it, and they can tell them what has worked for them.
Well, you've had over 2,000 participants come through this program, or you've helped over 2,000 individuals. What would you say attributed to that success?
The need within the community first and foremost, but we really try to acknowledge that we're going to be welcoming someone into this program on one of the worst days of their lives. And our goal here is to welcome them with open arms, understand that there are going to be challenges, such as financial challenges, there's going to be relationship challenges, there's going to be legal challenges, and we try to put things back together.
Well, the Healing Place is deeply rooted in collaboration. You've got partners like Trillium, Novant Health, New Hanover County. They all help make this possible. Can you share why those partnerships matter for your clients?
Yeah, so we have a lot of partnerships which really allow us to take not just addiction into the picture, but also a human being. So we're able to connect people to medical care, we're able to connect people to benefits. We really try to add multiple things into people's lives so that they can get better long term. In a lot of ways, I think of this place as kind of a landing pad, and we will walk with people as they go through the recovery process, but it's something that they're going to have to want, they're going to have to put effort towards.
Well, this is a free program that you provide. How can the local community get involved and support your mission and initiative?
So there's a number of different ways to get involved. So donating your time, we have a clothing closet here so that we can allow people to have essentially the Maslow's hierarchy of needs, the bottom rung, food, shelter, clothing, anything that relates to that. But also this is a program that is at no cost to the individual. So it is a community-based program, and we need the community to support that both with their time and with their monetary support.
And for someone listening right now who may be looking for support or a recovery program for themselves, how do they get started?
They can call the main number or they can show up. This place is open 24/7, 365. We have a 28-bed detox, and that's generally where people get their first encounter with us. The bigger program, we have 200 beds on campus here, and this is a long-term program. So in order to make sustained change and behavioral change, you need time. And that's one of the things that really does differentiate us from other programs in the region.
Well, we're going to hear a story from one of your alumni, Annette. So let's check in with Annette. Annette, thank you so much for being here. Tell me, what was life like before the Healing Place?
Life was dark before the Healing Place. I was stuck in a cycle of addiction, of isolation and shame. I struggled day to day just to stay alive. I'd pushed everyone away. My friends and family didn't recognize me. I didn't recognize myself. And I was just in this deep, dark place of alcoholism, and I didn't know how to get out. I had a friend tell me about the Healing Place, and I thought I'd give myself a try and just give myself a break and change something in my life.
So tell me what it was like when you first got here. I'm sure it was scary. So what were some of your first thoughts, and what would you say helped you during this program?
I was terrified when I first came to the Healing Place. The peer support really changed my life. Being in an environment where people had gone through what I had gone through and had the same experiences really changed everything for me. I knew that the staff wasn't going to give up on me. I knew that my peers weren't going to give up on me even when I made it hard. The structure also changed my life. It was something that I was missing for years. The accountability, the discipline, the connection really that I got from this place has been everything for me.
Well, what would you say to someone right now that's struggling with addiction and maybe is ready to take that first step?
You don't have to be ready, you just have to move. You just have to make a change. And the Healing Place is so low barrier that you don't have to bring anything but yourself. You just have to show up. And it's about time that we show up for ourselves and we give ourselves a chance. I have found purpose, I have found hope through this program, and I've made friends. I've built a life for myself that I'm so proud of, and I am really grateful that I made that first step.
Well, recovery is possible, and at the Healing Place, nobody has to walk the path alone. To get started, for more information, you can visit their website or give them a call. That's it for this edition of Medically Speaking. You can watch any of these segments and get more information anytime on foxwilmington.com. We'll see you next time.